Welcome to this educational video on gastric cancer, also known as stomach cancer. In this video, we'll explore the causes, how it develops, its prevalence, symptoms, diagnosis, treatment options, and ways to prevent this serious disease. Our goal is to provide you with a comprehensive understanding of gastric cancer and empower you with knowledge. So, what causes gastric cancer? While the exact cause is often multifactorial, the biggest culprit is Helicobacter pylori, a bacterium that can infect the stomach lining. Chronic infection with H. pylori can lead to inflammation, ulcers, and eventually, in some cases, cancer. Other risk factors include a diet high in smoked, salted, or pickled foods and low in fruits and vegetables. Smoking, excessive alcohol consumption, obesity, and a family history of gastric cancer also increase the risk. Certain genetic conditions, such as hereditary diffuse gastric cancer, and previous stomach surgeries can also contribute to the development of this disease. It's important to remember that having these risk factors doesn't guarantee you will develop gastric cancer, but it does increase your susceptibility. Let's delve into the pathophysiology or how gastric cancer develops. It typically begins when healthy cells in the stomach lining undergo genetic mutations. These mutations cause cells to grow uncontrollably, forming a tumor. H. pylori infection triggers chronic inflammation in the stomach, leading to changes in the cells of the stomach lining. Over time, these changes can progress from precancerous conditions like atrophic gastritis and intestinal metaplasia, to dysplasia, and finally, to invasive cancer. The cancer can then spread through the stomach wall, affecting nearby lymph nodes and potentially metastasizing to other organs like the liver, lungs, and bones. The specific molecular pathways involved are complex and involve various oncogenes and tumor suppressor genes. Gastric cancer's epidemiology varies significantly worldwide. It's more common in Eastern Asia, particularly in countries like Japan, Korea, and China. Other regions with higher rates include Eastern Europe and parts of South America. In the United States and other Western countries, the incidence of gastric cancer has been declining over the past few decades, likely due to improved dietary habits and widespread H. pylori testing and treatment. However, even with the decline, it remains a significant health concern. The disease tends to be diagnosed more frequently in older adults, typically after the age of 50, and is slightly more common in men than in women. Socioeconomic factors also play a role, with higher rates observed in lower socioeconomic groups. The signs and symptoms of gastric cancer can be vague, especially in the early stages, which often leads to delayed diagnosis. Common symptoms include persistent indigestion or heartburn, stomach pain or discomfort, nausea, vomiting, loss of appetite, and unintentional weight loss. Some people may experience a feeling of fullness even after eating a small meal. More advanced symptoms may include blood in the stool, vomiting blood, jaundice, a yellowing of the skin and eyes, and ascites, a fluid buildup in the abdomen. Because many of these symptoms are similar to those of other, less serious conditions, it's crucial to consult a doctor if you experience persistent or concerning symptoms. Diagnosing gastric cancer typically involves a combination of tests and procedures. The most common and important test is an endoscopy, where a thin, flexible tube with a camera is inserted into the esophagus and stomach to visualize the lining. During the endoscopy, biopsies are taken from any suspicious areas. These biopsies are then examined under a microscope to check for cancerous cells. Other diagnostic tests include imaging studies such as CT scans, MRI, and PT scans, which can help determine the extent of the cancer and whether it has spread to other organs. Blood tests may also be performed to assess overall health and to look for tumor markers, which are substances released by cancer cells. Gastric cancer is classified based on several factors, including the type of cancer cell, its location in the stomach, and its stage. The most common type of gastric cancer is adenocarcinoma, which develops from the cells that line the stomach. There are different subtypes of adenocarcinoma, such as intestinal and diffuse types, which have different growth patterns and prognosis. The staging of gastric cancer, using the TM system, a tumor node, metastasis, is crucial for determining the appropriate treatment and predicting the outcome. The stage describes the size and extent of the primary tumor, whether the cancer has spread to nearby lymph nodes, and whether it has metastasized to distant organs. Treatment for gastric cancer depends on the stage, location, and type of cancer, as well as the patient's overall health. Surgery is often the primary treatment for early-stage gastric cancer and may involve removing part or all of the stomach, along with nearby lymph nodes. Chemotherapy is often used before or after surgery to kill any remaining cancer cells and to prevent recurrence. Radiation therapy may also be used to kill cancer cells or to relieve symptoms. Targeted therapy and immunotherapy are newer treatment options that may be used in certain cases to target specific molecules involved in cancer growth or to boost the immune system's ability to fight cancer. A multidisciplinary team of specialists, including surgeons, oncologists, and radiation oncologists, will work together to develop the best treatment plan for each individual. While there's no guaranteed way to prevent gastric cancer, you can take steps to reduce your risk. The most important is to get tested and treated for H. pylori infection. A healthy diet rich in fruits, vegetables, and whole grains and low in processed and salted foods can also help. Avoiding smoking and excessive alcohol consumption are crucial. Maintaining a healthy weight and engaging in regular physical activity are also recommended. If you have a family history of gastric cancer, consider genetic counseling to assess your risk and discuss potential screening options. The prognosis for gastric cancer varies widely depending on the stage at diagnosis, the type of cancer, and the overall health of the patient. Early-stage gastric cancer that is surgically removed has a much better prognosis than advanced-stage cancer that has spread to other organs. Recent research has focused on developing new targeted therapies and immunotherapies that can improve outcomes for patients with advanced gastric cancer. Studies are also underway to identify biomarkers that can predict which patients are most likely to benefit from specific treatments. Advances in surgical techniques and radiation therapy are also improving outcomes and quality of life for patients with gastric cancer. While gastric cancer can be a challenging disease, ongoing research and advancements in treatment are offering new hope for patients.